So here's a question that one of my students sent to me because they needed a little bit of help answering this question. And it was actually a question that I'd originally assigned them. So I wanted to take this as an opportunity to work through this in front of everybody because it might be something that helps you in answering questions like this. So this is a priority question. So we're going to work on answering this priority question together. And we're going to use, of course, my tootRN 3 steps and our toolkits that we use to help better critically think. So the first thing we're going to do is read the question. The question says, the assistive personnel tells the nurse that the client has a blood pressure of 78/46 and a pulse of 116 using a vital signs machine. Which intervention should the nurse implement first? I can tell that this is a priority question, right? Because we're using a priority term, first. The good thing about the NCLEX is that priority words like this will be bolded, so they're easy to see. So I know it's a priority question. Now, first step with our tootRN 3 steps is identifying the ask, which is here. The question is just asking us, what do you do first? What do you do now? Now, with priority questions, we want to make sure that we're thinking about it in a way of, what's the thing that I have to do right now in order to avoid the worst potential outcome from happening to our client? And also, what's the thing I have to do right now that directly addresses the issue? So now that we have our ask, we're going to move on with our problem. We got to find the problem. And to do that, we have to take the information that the question is giving us in order to apply our knowledge and figure out what's going on. So it's telling us the AP has taken the client's blood pressure and pulse. They have a low pressure and a high pulse, right? So they're hypotensive and tachycardic, and they use a vital signs machine. So what do we think about that? Sounds like this patient's showing vital signs that support shock, right? Maybe it's the vital signs machine and something's just wrong with the machine or the AP used it incorrectly. But we're looking for the thing that we have to do right now. So something could be wrong with our patient, or maybe there's an error with the machine. So what do we have to do now? First, priority. So we got to think about outcomes. If there is something wrong with our patient, we got to get on top of that now, because if they're showing these vital signs that support shock, well, this could be very, very dangerous for the patient and life-threatening. If it's something with the machine, okay, what's our priority, right? Checking our patient or checking the machine first. So now we're going to move on to find the solution, which is looking at our answer options and thinking about those outcomes. So we got to think, what's going to be the end result of the action that we choose? What's our priority? What's the thing that's going to help us to avoid that worst potential outcome? And what's the thing that directly addresses the problem? So if we notify the healthcare provider immediately, what's that going to do for this problem? Nothing, right? Because if our patient is hypotensive and tachycardic, or even if there was a problem with the vital signs machine, what is telling the provider going to do for that? Nothing. Have the AP recheck the client's vital signs manually. Okay, so we can have them go back in and recheck it again. But thinking about the outcomes, if our patient is hypotensive and tachycardic, and we have them go back in there and check their vital signs, what are we doing for the client? What have we done for this problem? Nothing. Place the client in Trendelenburg position. Well, again, coming back to our problem, they're truly hypotensive or tachycardic, or it's truly just an issue with the machine. But we can't do something, right? We can't do something about the problem if we're not sure what the problem is. So first, we got to make sure that we know what's going on here. Is our patient really having a problem, or is it a problem with the machine? So this can't be it. So D says, assess the client's cardiovascular status. You're going to do this first. And yes, that's right. Because this could be true, these vital signs, or it could be a problem with the machine. But the priority, the thing you have to do right now is go in there and check your patient, because these are signs that they are experiencing shock. We need to go in and check to see if our patient is okay before just saying, oh, it's the machine, do it again. The machine's not a priority, our patient is. And so D is the correct answer here.